Good morning, everyone. Today, sharing with us in our monthly men's breakfast. It's good to see everybody in. People are coming in from YouTube, coming in on different platforms, New Psalmist site, on Zoom. Just glad to have you today and have you be a part. So listen, we're going to be getting our breakfast in a minute. Mine is right now. Praise God. The First Lady is doing the bishop right. She's bringing me breakfast. Y'all, I have cream chip beef today, Maurice. I have cream chip beef today. Oh, I'm so excited. I couldn't use the kitchen from New Psalmist, so I figured I'd have breakfast. My wife figured I'd have breakfast with the men right here. Brian?
Yes, sir.
But it is good to see everybody. I've got Brian and Antoine sharing with me today. And before we pray, before we get started, I'm gonna open us in a brief word of prayer, then kick it to Maurice with some info. Then we'll give you a couple updates, and then we got a great discussion plan for today. Father, in Jesus' name, thank you for letting us gather one more month, come together as the men of the church with the pastor and the brothers who are strong in your word. Now meet us here, guide us and direct us, and bless this encounter. In Jesus' name, amen. Amen. Maurice, I want to kick it to you now.
All right. Well, good morning, brothers, and good morning, Bishop and panel. Dr. Theo, glad to have you on today. Today would have been one of the days we would have been starting into our Men's Day celebration. Needless to say, that's a little different, but we're doing something anyway. And one of the things that I love, as I even put in the email, was that this would still be a day that we would still come together and have breakfast with our bishop. And so I'm glad we were able at least to do that much. And for those out there that are fathers, happy Father's Day to you. I hope that this one, like so many other things that are changing, we get a little bit more acknowledgement this time than we would normally get. So enjoy your Father's Day. I know the weather is kind of tricky, but be safe, but enjoy your Father's Day. And I don't know about you, but I'm excited. I needed this today. It's been a heavy week, man. It's really been a heavy week. There's been a lot going on, and I'm grateful to God that we had this time. We could get some info and just come together, sharing with one another. Not the same as us being together, because I don't get that energy that we share when we're physically together, but I'm grateful that we at least have this. So without further ado, Brian.
Well, good morning. Again, I just want to say happy Father's Day as well. And Maurice talked about it being a heavy week. It's been more than a heavy week. This has been a heavy year. 2020 has certainly made its presence known. And we're hopeful that everyone is staying in the right frame of mind, recognizing that you are built for this season. It is a tough time, but we're all pushing through. And part of the reason why we've been talking about building a community of men is so that we can be here for each other and with each other, to grow with each other, to support each other, to love each other through this. So this is just an extension of that. And it's fortunate that we have a bishop that recognizes that men have needs, and those needs don't stop at talking about sports or going to the barbershop or all of the kind of the stereotypical men thing. Like, we actually have feelings, we have thoughts, we have desires, we have issues that we want to discuss, and we've created this forum, or he's created this forum to give us the opportunity to do that. So I'm so thankful that we have that, and so we appreciate that. And Bishop, I guess you're ready to get it. I see you with your chip beef. I don't want to interrupt you. You look like you're really enjoying that thing. So you're on mute though. You're on mute.
All right. There we go.
Yeah, there you go.
I'm enjoying every bite. Normally on Saturdays at the breakfast, I'm the one who doesn't get to eat.
Right.
But being home, I kind of like these home breakfasts. My culinary arts department of my home takes great care of the bishop in moments like this. and I have had breakfast and I'm still munching on it and enjoying it.
Amen.
Well, let me share something with you guys. Tomorrow is Father's Day, and we have a special Father's Day worship. I'm not going to give you the details, but I will tell you it's going to be an interesting sermon. One, I don't think you've ever heard a sermon like what you're going to hear tomorrow. So I'm inviting you to tell your friends, your loved ones, get everybody online, tell your families to be online with you tomorrow to share worship with you. If you can do a Zoom room while all of you are watching your televisions or your whatever. I like to watch the services on the television because you can get YouTube on your TVs now. So I put my TV on and watch the service on the TV. And somehow I actually feel like I'm in church. It's a little different when I'm watching it on the phone or something. I feel like I'm in the small space, but when I have that thing on TV and I just go around there and sit in my seat on the sofa, I feel like I'm in church and I'm sitting with everybody else. Sometimes I even start a little Zoom with some friends who are also watching it. And we talk like we're in church. Do you know what I learned by being a pastor? I learned that folk talk a lot in church. Now, let me tell you, I have learned that folk talk a lot in church. When you do these Zooms with other folk, my Jesus, they be talking the whole while. You gotta really go back and watch it again. Because did you hear that? Oh, John, Lord, have mercy. And then sometimes they get on another subject like, did you take the food out the refrigerator? That kind of stuff. So
that's what happens in church, Bishop.
It happens in church, Maurice.
That happens in church.
Well, listen. I mean, I guess that's what all of this is about. This is also about discovering new things, discovering new ways, discovering different aspects of life. This is a season of discovery. It is a season of discovery. Today, I want to do a couple things because a lot has happened in the 1 month since we met. It's hard to believe that last month we met and I talked about post-traumatic stress disorder. Post-traumatic stress disorder. And before that, a little while ago, we had Jeff Johnson talking with us, along in a dialogue with us. And here it is. We've had this breakfast March, April, May, now June, 4 months. We've gathered like this. Many of us never thought it would be this long. Many of us never thought we'd be out this long. And most of us thought we'd get in this and then get out of this. But we've been in it for a while, and it started as a medical problem, and it is advancing. Now, 2 things I've got to say before I go any further. I've told you about tomorrow, the things that are going on. July the 12th is church anniversary. We're going to be doing something special. That's a Sunday, church anniversary. So put it on your calendar. July the 12th, July the 12th. But here's something for any man who is dealing with unemployment. You're getting unemployment and the like. Maybe the job hasn't called you back or you've been able to get your unemployment. Understand that unemployment runs out next month, the federal side of it. That's, if I'm not mistaken, Brian, you correct me, that's the $600
Yes.
additional that is being added to the unemployment check. That runs out next month, which means that you have to now start making serious adjustments to how you utilize that money, because you're not sure when the job is going to come or if they're going to extend those benefits. I'm not sure if it's July or September that the foreclosures and the evictions run out, but that has a time stamp on it also. So start preparing yourself if you're in those categories for how you will rearrange your money and how you will develop your own sense of getting ahead during this crisis. It's a disruptive crisis, so you have to be disruptive in how you think about how I will make some new money, not illegally, but legally. And we'll talk more about that near the end. So I just wanted to drop those things so that I put them in your consciousness so you can tell your sons, your daughters, people around you who work with you, other folk, telling them if they're on unemployment, the $600 that's added to the state unemployment will run out. Somebody said, well, what if I haven't gotten my unemployment? You will get it back to the time that you applied for it, when it began. So you may not get the check to July, but understand once you get your month, July is the cutoff. It is the cutoff date for it. So please be mindful how you measure out your money. Today, we want to start with the continuing condition that goes on, and then what's happened in the last 30 days. In the last 30 days, we've seen a complete upheaval of American society, a good upheaval. And we're going to talk about what's happening in the streets. But we also want to get some firm information. You know, I had the church town hall for on medicine this past Monday, and it was out of the sight. But you know, I have to do something special for the brothers. You know that. You know, we get our own, and we have our own. We have the one and only Deacon Dr. Theo Stevens.
Morning.
Dr. Theo Stevens. He shared with us Monday. I wanted him to come today to talk to the men because, you know, we got some of our own issues and some of our questions we want to ask. Now, in the bottom of your screen, you'll see a chat and you'll see a Q&A. A chat and a Q&A. Be just greeting folk, and if you want to talk to somebody, talk to them there. But I need you now to start writing some questions in the Q&A that you have for Dr. Theo. Question, and don't think any question is too small or insignificant or dumb. They're not. They are smart. So ask your questions. Dr. Theo is going to be available right now, right with us. So I want to introduce Dr. Theo. He's one of our deacons. And I've known Theo as long as I can remember. He's taken care of the health of my family. He's kept me going. And so I respect his medical ability far more than I could ever have time to talk about. Dr. Theo, can you explain to the guys what this is that we're dealing with?
Good morning, everyone. I'm going to give you a kind of a brief overview of what the virus is and why we need to be concerned about it. The coronaviruses, again, are a group of viruses that look like a golf ball with spikes on the end of them. The spikes look like a crown, and crown comes from the Latin word for corona, so they call them the coronaviruses. There are 7 known coronaviruses that can infect humans. 4 of them make up some of the viruses that are responsible for the common cold. So 4 coronaviruses cause the common cold. The 5th coronavirus caused a Mediterranean outbreak some years back. The 6th coronavirus caused an outbreak of what was called SARS back in 2003. SARS stands for Severe Adult Respiratory Distress Syndrome. That SARS outbreak was pretty much squashed because China jumped on it and quarantined everyone and took measures to abate it, and it really didn't spread that much. And in fact, it didn't even have time to make a vaccine for it because it went away so fast. In December of last year, 2019, a new coronavirus was identified. The first called it a novel coronavirus because they had never seen it before. When they examined it, they found that it was related to the coronavirus that caused the first SARS outbreak. So they called it SARS coronavirus number 2. And it caused a condition, a disease they now call COVID-19, coronavirus disease 2019, or 19 for short. Started in China and quickly moved to involve the rest of the world. Why do we need to be concerned about it in this environment of whom I'm talking to now? Is because it can cause severe symptoms. Most people get it and may recover from it. However, there are some people who get it and at higher risk for having more complicated symptoms and for dying from it. And there are also some people that have certain underlying conditions. And now I'll talk about what those are. But if you have those conditions, you're 4 times more likely to be admitted to the hospital and you're 12 times more likely to die from the SARS virus. Why do you die? Because your body cannot recover from the virus. Usually, if you got a virus, your own body takes over and kills the virus and recovers. However, if you are not in optimal health, you have a higher chance of your body not being able to fight the virus, and you can die. And the most common conditions that are detrimental to you not being able to fight the virus are having heart disease and high blood pressure, having diabetes, or being of an older age. Because in those conditions, your body is not in optimal shape. There's a word I like to use called homeostasis, and our body is made up of different systems: the cardiovascular system, the neurological system, the respiratory system, and all of our systems have to work in conjunction with each other for our bodies to work up in an optimal state. If you have high blood pressure, diabetes, ongoing health symptoms, if your body is out of homeostasis, and other systems have to compensate in order to keep your body in optimal state. For instance, if you have high blood pressure, your heart is pumping against all of that pressure, and your heart has to stretch to be able to keep your blood going. Your kidneys don't get enough blood, your kidneys start to slow down, and you end up with complications that you may not even know about. So if you have those conditions, you're a much higher risk. And so those I know most of us who we're talking to are African American, and most African Americans have those underlying conditions. So you'll find they're finding that we are the second highest group that have the significant complications for the coronavirus. What are the complications? The main one is severe respiratory distress. If you get the virus, the treatment is you stay home and your body will recover. Or if you have severe respiratory distress, you end up in the hospital on a ventilator. And that's not good, because then your body starts to shut down. You need the ventilator to support your lungs. You need medicine to support your blood pressure. You may get a second infection, such as pneumonia, and your body's already trying to fight the SARS virus. Now you got to fight pneumonia. Your heart can't work. Then you start to get what's called multi-organ failure. Your kidneys start to not work. Your liver starts to break down. Your blood pressure drops, and you go into shock, and you can't get enough blood flow. And with the SARS virus, they're also finding people are developing blood clots, and the clots are stopping your blood from flowing, and it's not good. Once you get multi-organ system failure, you're probably going to die. And so what can we do to mitigate this? There's two main things. The main thing you need to do is to keep away from people. They're calling it social distancing. It's really physical distancing, because most of the virus is transmitted from us talking and coughing and sneezing. And if you're just talking, the droplets can spread about 6 feet or less. So they're saying if you keep at least 6 physical feet from someone, if you don't know if they have the virus, you have a decreased chance of getting the virus. Those are some places where the virus can get on surfaces and stay there for a while. So any surface you touch, when you wash your hands with warm, soapy water. The reason you need warm, soapy water is that the virus is a golf ball. There's a layer of fat around it, and the fat has spikes, and the spikes of the virus used to attach to your skin and attach to your respiratory tract. Soap disrupts the lipid layer, the fatty layer, and the spikes fall off, and the virus cannot attach to your skin, and it cannot attach to your respiratory tract. So wash your hands. It's very important. Wash them as often as you need to. So whether you prevent transmission or catching the virus, is to stay away from people. Whether you prevent transmission is wearing a mask. The mask is to prevent others from getting the virus. If someone is around you and not having a mask, if they have the virus and don't know they have it, they can give you the virus. There's something called asymptomatic transmission, and there's something called pre-symptomatic transmission. You have the virus, you don't know it, and before you get symptoms, you can still pass it on to someone. The problem is that we don't know what the virus is going to do. Yesterday, the World Health Organization said they had the highest rate of new cases since they started. So the virus is not going anywhere. There's a lot of pressure to open up, and the people are going back out. I don't know if any of you saw that CNN story where they had 16 people that went to the bar because they wanted to hang out and have fun. And all 16 caught the virus in addition to other people in the bar. You're hearing all of these states where the virus is still going up. Now, Maryland is doing pretty well. We had our peak back in April, and our cases seem to be going down. But you're hearing in other states where the virus is going up. People are going out, hanging out, acting like it's not going on, but the virus is still there. So what we need to do for ourselves is to keep away from people, avoid mass crowds, avoid places where you're going to be in prolonged contact with someone. because we really don't know what this virus is doing. Right now, we're still in the first wave. We do not know if it's going to be a second wave. It may not be, but we're still in the first wave, and it's still out there. Now, again, people are still going out, and they're not wearing their mask, and you can't do anything about them. You can do something about you. Now, you may not get sick if you catch the virus, but you can take it home to someone that's elderly, someone that has one of those predisposing conditions, make them sick, they end up in the hospital, and they die. And so the main thing is to prevent yourself by physical distancing and to prevent transmission by wearing a mask. If anyone has any questions, I can answer them in the question and answer. It's kind of a brief overview. If you anything I forgot, let me know and I can address it for you.
Deacon Theo.
Yes.
There are a number of questions in the Q&A, and you were just talking, so I guess I'll try to start at the top. And one of the questions from Deacon Gerald actually is, what about the virus mutating? We've heard that it might change, and how was that impacting the search for a cure?
Viruses do mutate. Actually, in fact, there's a debate on whether viruses, even a living organism, the virus cannot replicate by itself. It needs your cell to replicate. And what it does is it attaches to your DNA and uses your DNA to reproduce other viruses. Sometimes the DNA changes, and so you get new viruses. The flu virus changes every year. So every year you have to get new flu vaccines. Right now, we don't know if it's going to mutate. It can. And so the vaccine that they are trying to make may or may not work by the time the virus gets into that state. Right now, we don't know. And so they're trying to make vaccines based on the virus as it is now. If it mutates, we don't know. The flu vaccine is made up based on the flu virus from the year before. They look at the viruses, they project what they think is going to be the virus for the next year. They make up the flu vaccine. Sometimes they get it right, sometimes they don't. I think 2 years ago, they got it wrong, and there was a large flu outbreak. So right now, we don't know. So the best thing we need to do is just not get it. You don't want to get it, and you don't want to give it.
Another question, and then I guess Brian and Mo will jump in with the other questions. The other question, you talked about the country opening. You mentioned the situation with the ladies who went out and then they, recontracted the virus. How often should we get tested? For example, like I was tested back in April, and at the time I was negative. Does that mean I'm negative forever?
You said the right words at the time, because you can. Yeah. It's like I compare this to getting the flu vaccine. If you get the flu vaccine takes 2 weeks to be effective. If you get the vaccine today and around tomorrow with the flu, you're going to get the flu. So if you get the test today and you don't social distance, you go out tomorrow and catch the virus. So there's no recommended time to get tested. If you're negative, then you want to keep away from people, because you don't want someone to give it to you. If you're negative, that's a blessing. Stay away. Some of my friends, I haven't seen some of my friends since March, because they may be asymptomatic, but they may have it, they may pass it. I don't need to get it. I don't need to get it. And so there's no specific recommendation for getting tested. You can get tested as often as you can, as long as you can get it paid for, but there's no guarantee that negativity today transmits to negativity tomorrow, next week, and so forth. And the virus is going to be here for a while.
Yeah.
Okay.
Hey, Doc, one of the questions that's in the chat, and you talked about some of the pre-existing conditions that people have that make them more susceptible. One of the questions was that if you are managing your high blood pressure or your diabetes or whatever with medication, does that impact your susceptibility or not? Or is it just the fact that you have the underlying issue?
It's both. If you have diabetes, you're already at higher risk for having other infections. Diabetes is somewhat of an inflammatory condition, they believe, and so your body is already kind of out of sync, and so your body's using other systems to keep itself in sync. So by having diabetes, you're already out of sync, and diabetics are considered heart patients. So your heart diabetes can affect your heart, it can affect your circulation, and you can have a higher chance of having this regular infection. So just by having diabetes, you're at high risk. And then if it's out of control, again, your body's even more out of homeostasis. So if you're in poor control, your body's trying to correct itself. If your sugar is really high, you're going to be paining a lot. Your kidney's going to be messed up. You're going to be dehydrated. You're going to have a bad heart. You're going to be more susceptible because your body's trying to fight the inflammation. And now how is it going to mobilize to fight another infection when it's really trying to fight the diabetes that you're not taking care of? And so having diabetes itself puts you at risk. And again, they haven't specified whether the poor control is going to make a difference, but they do know that again, if you're out of balance, it just makes it easier for the disease to take over. So diabetes, heart disease, high blood pressure are some of the main ones. There's some talk about maybe rather certain blood types may put you at high risk. I think a blood type A may put you at higher risk. They think that blood type O may put you at lower risk. They're still investigating that. If you're over age 65, you're at high risk. But then again, they're finding out in Florida that the main age now is in the 30s of people getting the virus. So as it's going along, we're finding out more and more. Again, what can you do? Don't get it. And look, as doctors, we go by studies, and the information is always changing. You do not want to be the one that's in the study. You don't want to be the one that say, "Oh, we got the first patient to find out if we catch it from some crazy way." You don't want to be in the books. You don't want to be in the studies. Stay away. Physical distancing. Now, if you have someone that you know that's negative, and you're negative, you can hang out all you want today. Because they may become positive, next week.
Dr. Theo, now we get into a kind of heavy duty segment of this. Brothers, if you're ready for us to talk heavy in the chat, just type the word yes. If you're ready for us to talk heavy, just type yes. Okay. All right.
All right.
All right, Dr. Theo, we have a lot of men who are single. They are not in or some of them may be in a.
Put it this way: they get tested, and whoever she is, she needs to get tested.
All right, she needs.
Today, she got tested today. You all get it today. You're good. If you got to get it next weekend.
Yesterday, if she got tested today.
Today, by next weekend. You don't know what happened during the week, so.
Can you pass this with saliva?
Probably. It's in your respiratory. It's in your respiratory sputum, so probably it's in the mouth. Actually, there are some new tests that are looking at that are based on getting saliva. So most likely, yes.
So what would your advice be to guys who have sung that song, "All Alone Am I," for these last several weeks and months? Would you suggest that this be a time of adventure? Or would you suggest this would still be a time to keep all the soldiers at home?
You don't want to have regrets. Nothing is that good that you want to have regret. It might be good for the minute, but then you're want to have regrets. And so again, it's like the old days when HIV first came out. There's a big thing because we didn't know who was HIV positive. And I have patients now who have herpes, and herpes can be passed on asymptomatically. So I'll tell them, if you don't know whether the person has herpes or not, you can't go by symptoms. Same thing with this virus. If you don't know if the person is negative, don't take the risk. It's not worth it.
So the kiss could be the kiss of death.
Could be the last good kiss you had.
Brothers, would anyone like to follow up this line of questioning? Feel free to.
Now there's some.
Be the difference between life and death. Go ahead.
I say if people are quarantining together, they're taking precautions, probably okay. But again, if someone's going out and they're not really being responsible and they're going without a mask and they have a high risk of catching it, I go to work and I come home. I go to the store with my mask. I come home. I'm not really hanging out anywhere where I'm trying to get it. So I'm not around people. So my wife is the same way. And so we're not around people. But if someone's going out and taking the risk, you really don't know if they're going to be around someone that can have it. If you both are pretty serious about isolating yourselves, it's probably okay. But again, you really don't know. So it's not the time for risks.
And brethren, if they're not living at your house and they're willing to come to your house, understand they take risks. Mm-hmm. So even if you got to get what I just said. If they don't live at your house, but they're willing to come to your house, then understand they are willing to take risk. And you have to ask yourself, is this the season that I want to take this risk? Because understand, we will not have a church funeral for you. You know, I tell people I'm trying to stay alive because I want to have a funeral when I die. So, you know, these are the realities. Mo?
I'm glad you asked that question, Doc, because that's real. You know, that's real, especially for a lot of men who are living alone. But at the same time, even those of us that are married, we still, and Dr. Theo, I think, you know, you would even add to this, those of us that are married still have to take the proper precautions if we have to go out and about, because we could be bringing something back home and not realizing it. Someone asked about, and I think you already touched on it, if you've already had the virus and you recovered from the virus, what are the chances that you can get the virus again?
We do not know.
And I thought that would be it.
We usually, there are many viruses that once you get them, you're immune to them. And that's the purpose of vaccines. Most vaccines, if you got vaccinated against hepatitis, if you got vaccinated against measles, mumps, rubella, you usually are immune to it. Or sometimes having the disease, you make antibodies. And an antibody is a protein. If you're attacked by a bacteria or a virus, your body makes antibodies. The white blood cells make antibodies that attach to the protein, to the bacteria. Other cells come around with these chemicals and kill off that virus. The antibodies hang around, so in the future they can attack it. So they make you immune. This virus, we don't know. And we don't know. And so there are tests, you can get antibodies measured. We don't know what the antibodies mean. It might mean you've had the disease, but doesn't mean you're not going to get it. We don't know. So again, we might know until we've been through, I guess, a year of having the disease and seeing what happens with people. So we don't know.
And I'm glad you said that, because you know, we live in a world where everything is fast, everything's done quickly. But the reality is it may take well over a year before they actually, because if I'm not mistaken, the trials and everything, the testing they have to go through has to be extensive to make sure it's effective and safe.
I'm gonna say this to us. If a vaccine comes up really fast, I wouldn't mess with it.
Yeah.
Most of the time, vaccine, first of all, you have to make the vaccine, you have to do a trial on it, and then they have to do a trial on humans to see what happens. And sometimes the effects don't come out, right away. And I do get vaccines. In fact, I'm due to get my second shingles vaccine probably next week. So I do get vaccines, but I use the trial and true. And vaccines really don't come out that fast. They're trying to rush because they want to get rid of the virus. But you want to make sure that it's tested and the side effects are minimal.
What I've been hearing is that, I mean, if you really think about it, it's not a guarantee that there will be a vaccine. I mean, we've been looking for an HIV vaccine for 40 years. And my understanding is that the fastest an actual vaccine that's ever come from start to finish was the mumps, and that took like 4 years or something like that. So
usually it does take some years, and you're right. There's no HIV. There's no HIV vaccine. There's none. Right. Herpes is a virus, and there's no herpes vaccine. You just catch it or don't catch it, but there's no herpes vaccine. So again, this is new. It's ongoing. It's only been about 5 months, and so again, like I said, they're finding out. It's day to day. It's day to day. And again, for us as Black men, we don't want to get it because we don't know what's going to happen.
Doc, in line with that, 2 quick questions. How often can you be tested if your job requires you to be out regularly? And can you be tested over and over? And secondly, you know, if it's time for your annual physical visit, are there any precautions you should take, especially about getting your labs and things like that?
Initially, some of the labs were closed because of precautions with the virus, and now most of them are open. What I recommend to my patients is make an appointment. You go online, use the LabCorp Quest. You can go online, make an appointment. They pretty much take you close to your appointment time. I think now they're having you wait outside. They call you in, you get your blood done, and you leave. And so those are pretty good precautions. Now in our office, and when you come in, we screen you, we check your temperature, we ask you the screening questions. And if we think you might have a high chance of having the virus, we stop you. So go get tested first. And so, you know, you still can get now you can get your blood work done. You can still get your physical done. But for, you know, a lot of doctors' offices are just starting open up. What we're doing this past week, we gave people the choice of coming in or doing it online. Some come in and stay, some are online. So we're kind of feeling it as we go. So this is totally new. So doctors, hospitals, dentists, we're kind of making it up as we go along. There are guidelines, but we're kind of doing what we can do.
How often should you get tested if your job requires, you to be out and about? When you see testing opportunities, should you just go and get tested?
I would, especially if it's free. It may depend on your job. I have some patients who are law enforcement, and they're out and about all the time. So I recommend them to get tested all the time. One of them actually did come back positive. If you have a job where you're in an office by yourself, then probably not. And so it really depends on your exposure to other people. There's no limit to, like I said, you can get a virus the next day. So if you get it maybe once a week or so, if you can get that, most of them now are pretty much covered by insurance and free. So if you can get it, I would say get it, especially if you're at high risk.
Well, we've been doing it at church free for persons. You don't have to have an appointment or anything. On the same weeks that we do the food program, we've been doing the testing. And it's free, and you get your results in 2 or 3 days. Is there a difference between the nose swab and the throat swab?
Well, actually, the nose swab is the throat swab. It's actually going all the way back to the throat. So that's why they're using a long swab. It's actually going all the way to your throat. So
it doesn't hurt, brothers. It don't hurt. Brian, it don't hurt. I didn't say it made me want to sneeze.
It depends who does it.
It depends who does it. Yeah.
Yeah, it made me want to sneeze.
And so if you have the allergies, your mucous membranes are swollen, so maybe harder to get through it. You may need to have a little bit of a.
Can you say something about masks? Can you say something? One more thing, and we won't keep you all morning. But can you say?
I don't mind. I'll talk all morning. I don't mind.
Okay, tell something about masks.
I had these the other night. This is what's called an N. Let me get it the right way. An N95 mask, and this is called a KN95. The N95 mask. It's the mask that's certified by the Occupational Health in the U.S. And it's certified for if you're working around someone that has a transmittable disease. It makes a very tight seal around the face. And most of the time, the strap goes over the top of the neck, top of the head and the back of the neck, makes it an airtight seal. If you have facial hair, this seal is not going to be airtight. Because these masks were in short supply, the FDA recommended that they will allow these KN95 masks to be made, and these usually have ear loops, and they're certified out of China. The 95 designation means they can stop 95% of viruses. These prevent transmission, and they prevent you from getting the virus. These are in short supply, so they recommend them only for essential workers. The mask that most people wear is the cloth mask. Let me say this very clearly. They do not prevent you from getting the disease. The reason for the cloth mask is to prevent transmission. Now they can decrease the chances, but the virus, if you're close to someone and they have the virus can get through. So the cloth mask is so for society to prevent transmission through society. So if you're around someone that does not have a mask on, they give you a higher chance of getting the virus. Have you ever seen a picture of a sneeze or a cough? You ever seen how far that can go?
Yeah.
A sneeze can go up to maybe 25 feet, they think. And so if you want someone that sneezes and coughs, you have a high chance of wearing it. So the mask is to prevent you from getting the virus. These KN95 masks prevent transmission. And so again, if you have the surgical mask. Now, Bishop has a collection of masks and face shields. Face shields you probably don't need unless you're around someone that's coughing and sneezing, and you just need to get away from them. But most of the time,
I'm prepared for the war.
So the masks are important from transmitting the disease for people who have no symptoms or may be pre-symptomatic. So you want to wear the mask, but the main thing to stop us from getting it is keep our distance. Keep your distance.
Hey, Doc, real quick on transmission. There's a lot of talk, obviously, about, and one of the questions came in about sports, right? And so the NBA is talking about going back to Orlando and, all of that kind of stuff. The question was, how can they be protected? But then the other question with gyms and stuff opening up is kind of related to that. Can it be transmitted through sweat? Because I know they'll be in contact in sports, but what about those folks that'll go to the gym and that kind of stuff? Can you talk a little bit about that?
Don't know about sweat, but I'm going through this myself because my sons are aching to go to the gym to play basketball. Now, the gyms themselves, I think they're opening up and they're spacing out the equipment. So some of them are putting up plexiglass to keep people away. So again, just supposed to wipe it down with a towel. The towel is not going to get. You may want to take your own Lysol or something and spray it down yourself. So I'm not sure what they're doing. We didn't know about sweat yet. They don't know. Now, contact sports again. My sons, they're aching to get back to the gym to play basketball. But again, you can't play basketball in a mask. You can't play sports in a mask, and so. I'm struggling with that myself. So, I really don't want that now. I don't think the gyms are open for basketball yet. I'm still struggling with what I'm going to do when they really want to go out and play basketball. And they've been home for 3 months. They're teenagers. They got to get out. But transmission and who they're going to play with, I don't know. There may be someone who doesn't wear a mask for the whole time. They could have the virus and bring it home to me. Mm-hmm. And so I'm going through that myself, dealing with that. So right now we don't know. So we don't know about sweat. Again, the gyms are going to be at a distance, but I would say take your own wipes. And even though they may wipe the machines down yourself. A towel may not be enough. Take your own sanitary wipe and wipe it yourself.
Theo, all the precautions that are out, two things. One, in chaos theory, there's a line that says life always finds a way to exist, that we will find a way to live with this. We have so many precautions now, and yet we are led by a leader who seems to take none of them seriously. And as such, sets up a question in persons' minds as to whether the science is true or whether the intuition is true. Many of us are more prone to trust the science, especially since almost 120,000. But will we find a way to live with this? And will there come a moment when this will be so in the community that the fear of catching it will not be that great?
Yeah, in theory, most of these outbreaks, if you look back in history, every single outbreak, no matter how bad it was, eventually either run away or settled down. So at some point we'll get there. There's something called herd immunity, where eventually much of the population becomes immune to it. The problem is that we don't know what percent. With something like with most viruses, you need 40% of the community to be immune. For something like measles, you need 90% of the community to be immune. So with this virus, we don't know. At some point, we're going to reach the top of the curve, and we're going to reach the bottom. What I would tell you to look for, instead of listening to what's out there, what we're looking at, is hospital admissions and hospital deaths. That's what is driving the numbers. Because the numbers will go up as people go out, and people may get sick and may recover, but what we're looking at is how serious is the disease. So what you want to look at is the hospital numbers. Because as the hospital numbers go up, if the virus goes up too fast, the hospital gets overwhelmed. For ones that need respiratory support, they can't get it because there are not enough hospital beds and there aren't enough vents. So no matter what everyone is saying, look, the numbers you want to look at are the hospital numbers. Because I said the numbers will go up for the virus because the population will get it, it'll go up. Right now, we still may be in the upswing because the World Health Organization yesterday, there was the biggest day of new outbreaks that they've had. So we're still on the upswing. At some point, it'll come down. Look at the hospital numbers. And that's what Maryland was looking at as far as hospital admissions and hospital deaths. If the deaths are coming down, it means most of us are doing better with it. So that's what I look at. No matter what comes out of the White House, as a physician, we always go with the science because the science can change, but the science is based on statistics. And they'll do studies and what are called blinded studies, meaning they'll do a study where the person who's getting the treatment doesn't know what the treatment is. The person given the treatment doesn't know. And over years, they'll find out what's happening. For instance, high blood pressure. They recently updated the high blood pressure numbers because they're always studying high blood pressure. And the normal number has not changed, but they found that the point of disease has changed. They used to say they want your blood pressure below 140 over 90. However, they found that above 130 over 80, they were still getting complications. Now, the updated number, based on the latest studies, is to control your blood pressure under 130 over 80. So we always go by the signs. There's something we call anecdotal evidence. You can say, well, my patients, I had 3 patients that this happened to, but that is not enough to tell because, there's placebo effect, there's individual factors. We call anything that can complicate the study a confounding variable. So if you have someone that's overweight, someone that's underweight, someone has the genetics, that everything may skew the study. So you have to have a study that gets rid of all these confounding variables, and that's what you can tell. So I would tell you, all the men listening, look at the hospital admission numbers, and that's when you can tell when the virus is kind of settling down.
One last question, Dr. Theo, then we'll be done. And incidentally, brothers, I'm going to give you, Dr. Theo, I need you to give out your number because Dr. Theo is taking patients, new patients. And brothers, those of you who have heart conditions or blood pressure or diabetes or gout or immune problems, and you said, well, I haven't been to the doctor, I'm not going to the doctor, the chances of you, if you take all the right precautions, the chances of you getting the virus are slim, but the chances of you having complications from some of the things you already have are great. So you have to start going back to a doctor. You have to start getting your diabetes checked. You have to start getting your blood pressure checked. You have to get your prostate checked. You have to get a colonoscopy, all that good stuff. So Dr. Theo is going to give us his number in a moment so that for those of you who don't have doctors, you can get one. But as children, we think about opening up schools in September and children going back to school. Can you speak a little bit to that? Because parents are going to be extremely nervous about how we're going to do that. I know, for example, some of our children's ministry programs will not be done in the facility when we open up. We will not be opening up with our nursery and other things. One, parents won't feel safe dropping them off. And 2, it's very hard to maintain social distancing with little children. They just run around. So we're going to be steering away from that. We're going to be doing all the social distancing in church when we open up, all of those kind of things. But when parents are thinking about September coming, what should they be mindful of?
Even the school systems aren't unsure because again, it depends on what the virus is doing at that time. If it's on the downswing, they may be able to open up. By the end, they're looking at maybe having smaller classrooms. Again, with children, you really can't control children. They're going to run around the plan and be involved with each other. That's going to be very difficult. So I think the schools are kind of making up. Like I think Maryland said they're going to have people come back on campus. They may have smaller classrooms. They may do some online teaching. Unfortunately, all of our children don't have access to online, so I don't think the schools really know. So I would say for parents, look at what's going on with the numbers. If the numbers come down, it may be helpful. But again, in September, we really don't know what's going to happen. There may be another wave. So I would just say just look at what's going on. Right now, we don't. Unfortunately, there's no good answer. We don't know right now what the virus is going to do. And so the schools really haven't said if they're going to open back up or not. Right now, they're hoping to, but they really don't know. They don't know. So right now, we just don't know enough.
So what the parents should do as summer goes through, stay in touch with their school and make sure they are in attendance when the school starts having its pre-registration and pre-involvement sessions and write their questions out.
Definitely.
And even send them to the school before those meetings so that they know those questions get included in the presentation.
And I would suggest in our area, you can get on, if you register, you will get emails on a regular basis to update you what's going on with the school. So make sure they're registered. If they have email address, it's registered with the school district and they'll get up-to-date emails as far as what's going on with the school.
Well, this is interesting, guys, and I hope you all are taking advantage of this. Somebody asked about wearing masks when you go through when you're walking around your neighborhood. Dr. Theo, what would you say?
I would say if you're just walking by yourself, you probably don't need it because you're out and about. There's no one around. You probably don't need a mask. I put them in your pocket in case you stop to talk. They have to go into the store. But if you're out and about riding, bike riding, exercising outside, there's no one around you. You don't need a mask. The mask is to prevent you from passing it on. So no, you don't need it.
Somebody asked about churches such as New Psalmist. How will we do social distancing? Easy. We're gonna put up spaces on seats where you can sit. Oh yeah, I'm very concerned about the safety of everybody, including myself. So I mean, so that in the short run, when I say short run, I'm 70 years old. I do plan to be around a good many more years. And I have learned to start living my life by terms of days and months. So that in the short run, we're going to have some inconveniences. We're going to have to learn to adjust, and we're going to have to find what is our next normal for living. And then we will adjust, and we will accustom ourselves to it. That curve going down, hospitals going down, deaths going down will mean a lot to us, because then it will mean to us that it is safer. Notice I didn't say safe. I said it's safer for us to consider opening the church back, the physical building. New Psalmist has never closed. Our campus at 6020 has been made unavailable to us, but New Psalmist hasn't closed. Why? Because we're here right now. We've been on Bible studies, worship services, town halls, discipleship, connection groups. We've been meeting regularly. We've been doing the work of the church. We've been doing ministry, but we've had to do it on different campuses. We have been worshiping in one place and serving in a lot of places, and we'll continue to do that. And when we are allowed to reuse our 6020 building, it'll be because the transmission rate is low in the city. Right now, it's still above 5, or in the state, it's above 5. Ideal is below 5, but that doesn't mean 5. That means below 5. And ideal is below 5. So we're trying to get it down as low as it can. And that means waiting. That means waiting. Waiting is not death. There's a song we sang, I don't mind waiting. I don't mind waiting. The Bible says, they that wait upon the Lord shall renew their strength. And Jesus has a great line, in patience, you possess your soul. So we're waiting. We're waiting till the numbers get to where they ought to be. Some folk are rushing to get back. They have a burning need to get back. I believe we can do a lot of what we do in a different way. And we're learning to do it in a different way. When I grew up, I had to put coal in the furnace. Some of y'all have never put coal in a furnace. All right, Antoine. All right, don't take your head yet. Thank you, Maurice. Thank you. Thank you. Brian, I know you ain't putting no coal in no furnace.
Absolutely not.
All right, I had to put coal. We had to go down and stoke the furnace.
I remember that, Bishop. Woo.
And the coal man would come and put coal in the coal pit.
That's right.
Yes, it was Soot City. It was Soot City. My brother broke his arm jumping off the coal bin. But we don't do that anymore. We don't do that anymore. I grew up killing mosquitoes in the summer, hearing them buzz past your ear. Oh, did you hear that, Antoine? You heard mosquitoes? All right. Young people don't know nothing about no mosquitoes. We learn to adjust. The world changes. And we will get to a point where we're going to be back in our facility. We will be back with all of the things necessary for us to function while a virus is very much among us. And then once that virus has run its course, we will again discover what is the new way in which we connect and the new way in which we do things. But I promise you one thing, I will not meet God and hear God tell me that I put my life on pause because of a virus. I may have put my life on caution in the sense of living it cautiously. Why? So I can live it productively. I live it cautiously so I can live it productively. I haven't hugged my grandchildren and I don't know when. I haven't hugged my children since I don't know when. But I love them to death and I hug them invisibly. And when I want to hug them, I call them. And I don't talk on the phone. I do video calls now. I could do ear calls when all we had was when I had physical touch. But I don't have physical touch now. So I have to do video calls. When I'm talking to my friends, I don't do ear calls if I can help it. Oh, my associate producer just came and helped me. She said they're not called ear calls, they're audio calls. Well, excuse me. Excuse me. The kitchen has come out and corrected me. God dang. So, y'all see what we go through here? So I don't do audio calls. I mean, if I can help it, when I'm trying to hook up with somebody, I do video calls because that's the way I can connect now. I used to would see you all. I would see Antoine maybe 2-3 times a week. I see Brian in the gym in the morning, but I don't see people now. And so an audio call is no longer sufficient. I have to do video calls. I would see my staff on the regular. Talking to them doesn't accomplish that. I don't even get enough data in an audio call. In an audio call, all you get is sound. When you're on a video call, you get sight. When you're in somebody's presence, you get mood. But I mean, there's so many different, and so I'm trying to get as much information as I can, because I don't plan to meet God and hear him tell me I put my life on hold because of a virus. I became cautious so I could still be productive. And I want you to do the same thing. Become cautious so you can be productive. Disposable masks, you can always throw away cloth masks. Theo, cloth masks, just wash them.
Yeah, they can be washed and reused as often as you need to.
Yeah. A mask is a mask is a mask, but now make sure it does cover your face.
Nose and mouth, nose and mouth.
Someone sent me a mask that would fit a hippo. The ears would have to be in the absolute back of your head. That mask was so big. I said, what do you think I got the head of a hippo? But you know, a mask is a mask.
Now, a question real quick, since you're talking about that. Those of us with beards, so is it okay if it doesn't cover the entire, come all the way under the chin?
It's just, I mean, if the beard is thick around here, then you can get things see. But those masks are not really airtight necessarily.
Right.
So it's probably okay. The only time the beard really matters if you have an N95 that needs an airtight seal. It's not airtight. But the regular mask, yeah, should be fine.
Yeah, that N95 will not cover a standard beard.
No, but it'll cover, but
Brian doesn't even have a real
sealed.
thick beard, but I don't think it covers all that. Well,
Yep.
No.
I actually cut mine down because I have to go into the hospital often. So
You need one of these. Go in with your brim and your hood.
I'm done.
Oh, I tell you, I'm prepared now. I'm ready for the war.
I told you, he has a collection. You got the red one, the green one for every suit.
Someone sent me this mask. My ears would have to be at the back of my head for me to fit this. But I got another one. There are all kinds of stuff, guys. Just let me tell you, my wife can find anything. In her last life, she worked on Inspector Gadget's show. And so let me hold this one, Tristan. Okay, I got another kind for those of y'all who want something different. Let me see if I can ever get it open. Yeah, there's another mask. And you can buy all this stuff at the cheap store. But remember, cheap is cheap. I'm ready again, baby. Put my mask on and my shield. I'm ready. This one I'm gonna wear on the plane. And on top of that, I'm gonna put a helmet. To prevent everything. So guys, also, make this light. If you wear this as a tight garment, not only will you see Dr. Theo, but you'll see the psychiatrist and the psychologist. Learn to loosen this thing up some. This is the reality we have. This is the hand you've been dealt. You cannot throw these cards in. You got to play them. And at least laugh while you play. At least laugh while you play. Dr. Theo, thank you so much. Now, Theo, how do they get in touch with you?
Telephone number 410-284-5210. 410.
Can somebody type that in the chat for us too?
410-284-5210. I can still answer questions in the Q&A for the rest of the session.
Oh yeah, so if you get any
So,
questions, guys, just throw them in the Q&A. And Dr. Theo will be answering. I'm gonna go back to him before we close to give us a sum up. But I wanna jump now to talk a little bit about what we've been going through and what we've been facing in this last reality. So let me just pull something up here real quick. I forgot I had to reboot my computer because I got locked out a little bit ago. So let me just pull up. But a lot of things have changed in the last month. We've all experienced some stuff in this last month that has just about blown our minds. We've been exposed to what we never really imagined would break out at the same time as of a pandemic experience. The pandemic came up, and then before we knew it, here was this new reality taking hold of our lives. And the new reality that has taken hold of our lives is a sense that change is in the air. It's what I call a protest movement has begun. And we've got to, I think we need to take a moment in time to talk about this and to really consider what this means for us. And so today, that's what I want to talk about. I want to share with you and talk with you today about a protest movement that has begun in our midst. And I've entitled it Justice Now. I don't know about you, but May was a month of revelation for me, the end of May. We started with the awareness of the murder of a Black man, Ahmaud Arbery, being killed just running through a neighborhood. And for some of us, that was one more nail in this coffin. And then before we knew it, it was Memorial Day. And we heard of a death in Minneapolis, same place where Philando Castile was killed, sitting in his car after saying to police, "I have a registered firearm." And in a matter of moments, he's dead. After that, we learn of a young woman, Breonna Taylor, killed, 8 shots, an EMT, 26 years old, in her own place, and a police report that says there are no injuries, and implying that the door was just open when they had a no-knock warrant. And then just last weekend, we watched Rayshard Brooks running and shot and killed. I was 18 in '68, and I remember the long, hot summers of the '60s. But I think now, once again, in a moment of revolutionary protest. This is a moment of revolutionary protest that some dramatic change is in the air. Revolutionary, we often think about means fighting, war. But what it really means is that some dramatic change is in the offing. It is a season of dramatic change. And I haven't seen one like this since I was a youngster in college in the '60s. I haven't seen anything that looked like this since we saw SNCC And there's some people on here old enough to remember Student Nonviolent Coordinating Committee. And we saw groups riding on buses and people going south and voter registration, all of that taking place. It's a season of revolutionary change. And let me just ask in the chat, how many of you are sensing that something has to happen? And if you are, just write yes in the chat. Something has to happen. You're sensing in your own experience that something has to happen. Something is about to break loose around here. And we also have a leadership that tiptoes to the edge of making it social unrest that turns from peaceful marches to violent confrontations. But we're seeing the steady footfall of young people in the street, black and white, gay and straight. I don't know if any of you noticed it this week, but there was what was called a transgender march. Now, I'm not into where you are on that question or whatever, but I just want to tell you something. The march looked like more people than were normally at the Vatican on Easter. That's how many people were out. There is a cry for change. There is a cry from every oppressed community almost to say, this has to end. It is a cry not just for change in America, it is a cry for what theologically we call justice. It is a cry for justice and righteousness, right relationship with people that produces a just way of living with people, a just way of living with people. Now, what makes this interesting is that a lot of the conversation will be diverted from the justice issue to the law and order issue. How many of you at work are having more and more people want to talk, want to have conversations? The great line, they want to understand. They want to understand the history that they have written but have not read. Let me see if I can put it again. They want to understand the history that our nation has written, but they don't want or have not taken time to read. There is nothing that is happening now that has not been happening. They just haven't read the history. Now, the reason I put it that way is because Napoleon Bonaparte put it this way. History is the myth we choose to believe. And part of the American myth is that African Americans have just been a weight on the American society. We had to be taken care of as their slaves, and they did our work, or they did the work for America. But since they have been freed, they have been an encumbrance, a weight around America's neck. We don't find jobs like our white counterparts. We don't live like our white counterparts. And white persons are sometimes tired of taking care of us. But that's born out of, that's a twofold understanding. One, there is a segment of the larger community that always has seen us as slaves and thought it to be our masters, and still does. There is another segment of society that sees us as children and has always seen us as their parents, so that we never have the right to self-determination. And as such, we may get invited to the dinner table, but we're never in charge of the menu. We're never in charge of what's written. And so now when these communities are making these cries for justice, the larger community is wanting to understand, what are they talking about? They already are being treated good. What is the complaint? I don't understand. And then it'll be buffered by almost like a sandwich where the subject matter is the meat, and here come the 2 pieces of bread. But there's so much black on black crime. And white police officers have to be careful going in black neighborhoods. And so that becomes part of the larger conversation. But it's interesting that we should hear all of this talk about black looting and black rioting and how we have to be careful. How many of you heard the discussions? And we even heard the leader of our land talking about, we've got to take back the streets. Now, are we taking them back from peaceful protests? Or taking them back from the looters and the robbers, he was saying? Understand, now hear what I'm gonna say. Understand, the looters and the robbers, and I'm gonna get to that a little deeper in a minute, had cover from the marchers. And the reason they were able to loot and steal was because there were marchers out there, innocent, peaceful marchers. If you want to get rid of the looting and the stealing, then get rid of the reason for marching, injustice. Then there will be no cover for folk who loot and steal, and the system that we have put in place, commonly called police, will go after looters and robbers. Will go after looters and robbers. But it's interesting that we would hear our nation talk about looting and robbing. You see on your screen 3 pictures. 3 pictures. And let me just share some little insight. The first one is what's called, is the city of Rosewood, Florida. The year 1921, month January 1921. A white woman accused a black woman of assault, a black man of assault. And this is the result. A thriving town occupied by African Americans, living well and doing well, almost self-sufficient, is totally destroyed, burned to the ground. It took till 1993, that's almost 70 years, for the state of Florida to admit they did not provide ample security and safety to the African Americans who lived there and pay them some form of compensation and give them some form of compensation in 1993. And this happened almost 100 years ago. But now that's not African Americans looting and robbing. The second picture is of Black Wall Street. It's called Black Wall Street. It is where the president is going today, or the city of, it's the city of Tulsa. It is the Greenwood District in the city of Tulsa, Oklahoma, where the president is relaunching his campaign. I need you to get a picture in your mind of the clashing realities. The clashing realities. This city, Tulsa, Oklahoma, had a district, the Greenwood District, that had become the home of affluent, in fact, it was the wealthiest Black community in America. The year again is 1921. The month is May. 1921. Both of these incidences happen, where Black people, who are the weight on a society, who need someone telling them what to do, who need to be guided and have their lives ordered by another group of folk. These people in the Greenwood district, had shops and stores. They were totally almost totally self-sufficient. They had grocery stores, markets, they had doctors, lawyers, they had professors, they had schools, they had everything. A Black young man, a shoe shine, was accused of touching or whatever, assaulting a white woman in an elevator that he would normally have to take to go up and down, to go to the only restroom that he was allowed to use. They don't know exactly what happened because no police notes were kept. They had to go back and research this almost some 50 years later. And they discovered he may have tripped and fallen in and touched her or whatever. Or maybe they were even going together. Nobody really knows. But what happened was, as a result of it, the people heard a scream. And when he got off the elevator and started going and looked both ways and went his way, they saw her on the elevator and she looked shaken up. She didn't press any charges or anything, but she looked shaken up. In fact, the investigators didn't think much of it, but it grew. He ran to his mother's home in Greenwood. A Black officer and a white officer came and arrested him, took him to the police district. Word got out that the whites might come and lynch him because they were lynching people then. They were lynching people. And so they carried him to the top floor of the municipal building to keep him there. And white crowd gathered around. Word got back to Greenwood that this was happening, and some of them came there. The Black folk came. Remember Sunday I preached about the privileged oppressed. Privileged, but don't forget you are part of the oppressed community. And so they stood to say, no, you can't have him. The police captain or chief would not give the Black man to the white folk so they could lynch him, which was their plan, to lynch him. And so the police chief tried to get everyone to disband and go home. One of the white gentlemen tried to tell a Black man that he needed to give up his gun. Black man said, no, I'm not giving up my pistol. And so what happened was somehow the gun went off. And that began it all right at the court steps. When the smoke cleared, everybody ran. It took about 30 seconds, maybe a minute. There were 10 white men dead and 2 Black men dead. Black men retreated to Greenwood District. The white folk retreated to an area to gain reinforcements, and they even went to the National Guard headquarters to get more munitions and get guns. But the National Guard had been alerted, and their commander stood there and said, you will not get any of this, and if you step in here, we'll shoot you. But that didn't matter. They went and got everything they had. Now understand, this is Black folk taking a stand, and they probably, yes, we stood our ground after 10 and 2. 10 white people were dead, 2 Black people were dead. But then they descended on Greenwood, a 35 square foot district, and burned it to the ground, looted it, robbed it, looking for anything they could. When it was over, 6,000 Blacks were in internment almost. It went on for hours. Black folk wound up losing $1.5 million in those days in real estate, $750,000 in personal property, the equivalent of about $32 million now. And we're talking about looting. And nothing, absolutely nothing was done. Their property was never recovered, and they were never recompensed for all of that. In fact, in both instances, Rosewood and Greenwood District, they didn't talk about it. They never rebuilt their areas because it had been impressed upon them. You all were privileged, but you also members of the oppressed community. The last photo is the one of Baltimore in 2015, Freddie Gray. Freddie Gray was arrested early one morning and dead by late afternoon. And before marches broke out, riots broke out. As in these other two instances, by the time help came, everything owned by Blacks was gone. In the latter instance, help was on the way even before trouble really broke out beyond police ability to control it. And yet these two instances of looting and rioting are never put up against the incidents of rioting and looting we see now, when our communities were destroyed and burned out. Now, many of us have not studied these. When we went to school, if we did not get our history in African American history or Negro History Week or Negro History Month, we didn't get it at all. We were not large chapters of the spring curriculum. But many of our youngsters have watched these movies, read these stories, and they know them now. And the young people today are not the young people of 30 or 40 years ago. The young people today are stepping up and stepping out. And they're not looking for mass leadership. They're stepping up and they're stepping out. And so what I call this is a revolutionary protest. And I want to declare to you, it can be prophetic. What we're seeing happening all around us is not just some angry Black people. This is a move that has the hand of God all over it. I need some brothers to get this. This is a move that has the hand of God all over it. Because it is time for there to be some justice. And our young people are not going to grow up without certain freedoms. We learn to take some things. They are learning to express some things. And they are speaking out. And they're speaking out and they're critiquing the dominant ideology of America. They're articulating the public brain, and they're expressing creative solutions. The first thing that they're coming up against is what might be called hegemony, being able to dominate somebody else. How many of you have worked in situations where you felt you were not heard and that African Americans did not have great opportunity? These marches that we are seeing now are a way of voicing. We are tired of not being heard. We are tired of not being listened to. We are tired of somebody being dominant over us. Dominant over us. And we will stand up. I have never been so amazed as I am of late of all of the folk who are out marching and making themselves known as they march. They are not ashamed to be in those streets, not ashamed to be out there. Young people are saying to their parents, I want to march. I want to be a part of this. And most parents are good parents, and they feel nervous about their children being out there. One, the pandemic. Two, they're afraid it might turn violent. Why are they afraid it might turn violent? Because it often has. It often has. When I was in college, I watched police charge over the wall at the University of Maryland, knocking people down, beating people as they ran. I remember being in Washington in 1968 when Dr. Martin King died on 14th Street, being tear gassed as the police came down, shooting off those rounds, trying to regain some authority in the streets. I remember watching peace protesters stand up in front of police, and some African Americans and I were standing together saying they have lost their mind. Stand up there singing, all we are saying is give peace a chance. Because in our context, that didn't work. That didn't work. But the young people that are out there now are serious about change. Now, here's another piece you have to get about what you're seeing out in the streets now. And that is that not only are they about change, they are articulating and speaking and declaring what people can't say themselves. They are what we call articulating the public pain. They're speaking what folk can't find words for. And what I found is, because a lot of people are saying we don't know who the leaders are. We're living in an age where where groups are just popping up. It is not about a central leader. It is about leaders. Anyone who is willing to step out. A man named Seth Godin wrote a small book called Tribes, Tribes. And in it, he says, people are looking for someone to follow. They are looking for someone to follow. So you have Black Lives Matter. You have Color of Change. You have this group. You have that group. You have the other group. And somebody is saying, well, where's the leader? There is no more one Reverend Dr. Martin Luther King Jr. The Reverend Al Sharpton is one of many leaders. He does not command the landscape. Leaders arrive and stand on the scene, and people coalesce around them, and they seek to get a task done. And so you're not going to see one leader. You're going to see a lot of leaders. So I heard someone say this. If you're interested in what's going on, what I'm going to encourage you to do, just like you have a church home, find a political home. And I don't mean a Democrat or a Republican. Find some group that is speaking to your issues and take up service in that group. Find a political home, some group, and I say it again, I don't mean a political party, Democrat or Republican, because they are wanting your vote. They're not telling you they want to support your issue. Now get what I'm saying? All the conversations I'm having are with people who want to see how we can get Black folk to vote. My conversation with them is, why don't you come and see what Black folk want? Why don't you come and listen to the various groups and find out what they're looking for and say, that's what we will do. You'll get more support from people who know that's what you're fighting for too. So find a political home, do your homework. Now, one group I would say look into is Color of Change. They're trying to do some major things. NAACP is resurging and coming back alive. They're trying to do some things, especially through youth. Black Lives Matter has a position, but there's so many groups. Just take time to listen and see who's saying something. You may say, well, I'm not young. Ideas are never young or old. They're just ideas. So see which ones link up with you and then articulate the pain that other people can't express. You say what they can't find the words to say, and then offer the creative solutions that come from being a part of the kingdom of God. I don't think God has us right now leading this, but I know he has us involved. There is no Dr. King at the head of all of this, but every churchman, every church person, every person of good faith must be involved in this movement from their Christian perspective. Because I believe as God leads this march, he is going to resurrect the significance of the name of Jesus and the power of his people in this move. When? I don't know, but we'll be there when he calls us. We'll already be in the number when he calls us to step up. I want to answer questions that you all might have about what's going on in the streets and what's happening around. And let me start with Brian and Antoine and Mo and even Theo. Any questions you all might have that you think could spur a larger conversation?
Yeah, Bishop, one of the things I was wondering about, I think you talked about it at the beginning, was, and I think I've heard this from a few people, what do they say to their white co-workers or friends who say they want to do something? And I think I remember someone even mentioning from the movie in the story of Malcolm X, when one of the white students asked him, what could she do? She wanted to be involved, she wanted to help. And at that point, he said nothing. But I think there's a different mindset now where, maybe we can get past the untrust that we've had in the past of people saying one thing, but they're not really into it, they're not vested in it. But I think we're seeing something different now. So what would you say to those?
Two things. One, I would understand people who do not know their history are doomed to relive it, be they Black or white. If white people do not know the history that they have written, both in blood, then they will be doomed to repeat it because they will not believe that they are capable of certain things. Black people were, tar baby is not just a statement. People were tarred and feathered. This is not something just from the Middle Ages. Black people were burned alive. Black people were dismembered. In one sad story, I can't remember if it's Rosewood or Greenwood or one of the other cities, African-American woman, I think it's Rosewood, African-American woman was hung upside down, and then her stomach split open and her unborn child taken out and left to die on the street. Inhumanity is beyond our ability sometimes to believe. In Poland in the 13th century, they would bring out Jewish women and lay them in the street and cut off their hands and then slice their stomachs open and leave their babies with them with no hands or whatever to be able, with their babies laid out. Hitler gassed 6 million Jews. And that's just the beginning. The Romans lined the Appian Way with the heads, with bodies rather, on crucifix.
Yeah.
Inhumanity is real, and until people can believe that they are capable of that inhumanity, they cannot. Second thing, I would suggest you say to white people who say, I need you to move from the statement and the belief that I'm not racist. Said, because I never called you one and I never thought you were. But I need you to become anti-racist. I need you to become an anti-racist, to stop racism wherever you see it. I don't need you to be someone who is not racist, but is complicit with racist activity. I need you to be someone in your community who stands up against racism wherever you see it. If you see it at the job, if you see it in the neighborhood, if you hear it in conversation, I need you to be an anti-racist, not just not racist. If you have Black friends, then honor them by making sure no one disrespects them. What else can they do? They can see the trouble and the strain. They can see it and learn it for themselves. There are parts of Baltimore City that have no market. Brian, you worked in development for years in Baltimore.
Yep.
I think you can speak to the plight and the anguish of what has to be dealt with, and what you have to overcome to make change there. What are some of the things you had to overcome to try to bring a little light in darkness?
Well, it's interesting you mentioned that, Bishop, because I went through years of doing projects in and around this city. We were one of the first to, if not the first African-American group to build a building on the stretch of Pratt Street from University of Maryland down to President Street. So we built a 21-story tower on Pratt Street, but it took us 6 years to get the project financed, because every time they realized that it was some young African-American men that were moving the project forward, mysteriously this financing that was in place would disappear. There are buildings and opportunities in this city, where the Pendry Hotel is. We had a plan for that site. But as soon as the community realized that the plan that they had, that they thought they liked and tacitly approved, was being proffered by a group of young African-American men, somehow they no longer liked the plan. The old Bank of America building at 10 Light Street, we had a project that was identified for that project. The building was for sale. They found out that we had the highest bid. They wound up selling it to somebody else for less money. So there are all of these types of institutional situations that impact your ability as a community to build wealth, to build infrastructure, and those sorts of things. All of those things play out, and those are things that have played out over the last 10 to 12 years. So this is not ancient history. This is recent history in a city that is primarily African-American. So all of these things
It has African-American leadership, and has had African-American leadership.
And had African-American leadership. So the question that I wanted to ask you, Bishop, is maybe to go a little bit into this idea of the social contract and why people are outraged by things like police brutality, or the impact of substandard education or substandard housing, and how when the social contract is broken, it makes people feel like they have no other choice but to lash out at the system. The social contract is what keeps us all working together, keeps us all living together, keeps us not, in a position where it's only about us, it's about the entirety of society. But when that social contract is broken, we are now feeling like we have no other place to go. There's no other way for us to interact except to push back on the system.
And what's interesting is, for African-American people, we have never felt that the social contract was a contract. We always felt it was a construct. For white people, it is a contract. It has consequences if you break it. For African Americans, it's a construct, something we look toward and we're working toward and building toward, but we never believed it was a contract. For example, a white building group that ran into the obstacles that you ran into would have recourse.
Right.
Would have had recourse. Social contract would have had recourse. You're dealing with social construct. You just gotta hope that somebody fixes it up. You all are the privileged oppressed. You're still oppressed, so you can't never forget that. You're just privileged to get in some of this and go far and do this and do that, but never think it's privileged properly. You are still in the oppressed, and we can stop you at any point.
Absolutely.
And give it to some young buck who doesn't have anything going on. The lowest white contractor is above you because he has the contract. You have the construct. It's still being built for you, and eventually it'll happen. Now, what's happening in this pandemic, however, is that the contract is being broken for everybody. It's being broken across the board because the keepers of the contract can't keep it. Everybody's being unemployed. Everybody's worried about their mortgage. Everybody's worried about their business, from the biggest businesses to the smallest. And so they're afraid that things may not work outright. And when we see the killings and whatever, I need you all to go back, for those of you a little older, I need you to go back to the 60s. Some of y'all weren't even born in, any of y'all born in the 60s? No, okay. In the 60s, you know, we have open housing, we have voters' rights, we have open accommodations, we have travel across state lines on buses, you can sit anywhere you want. But all of that was the result of another disruptive reality in America. We're dealing with the disruptive reality of the pandemic. That was the disruptive reality of television. Television brought the social construct into the homes of everybody, and they saw the inhumanity of their own race. They saw hoses, they saw dogs, they saw the blowing up of the church in Birmingham, Alabama, and the pulling out of bodies. They saw it on television. I watched Jack Ruby shoot Lee Harvey Oswald sitting in my living room in real time.
Mm-hmm.
They watched it and they realized their own capabilities. And they realized the dark side of America that they had put on blinders so they would not see. And then they were forced to see it. And the same thing is happening now. The disruption of the pandemic is forcing folk to see the very inhumanity. We sitting in the house. It's on television. People got it on cell phones. There are more hits on cell phone videos of all of this is like a TV show where people are taking B-roll. Somebody else has got this shot. Somebody else has got this shot, this shot. And the viewing of it becomes so great. Then we're dealing with a millennial generation that is, though we hate to say it, informed socially. They may not have social graces and may not be social the way we are, but they are informed socially and they are connected by certain principles. One is respect for one another. 2, accepting differences. 3, honoring possibilities. And 4, accepting our own truths. And they are coming together with that. These groups that are rallying, they did not just start this last week. They've been building their platforms. And this has been the catalytic moment for them to launch into action. And African-American people, my age, your age, Brian, and others, are beginning to sense that maybe, just maybe, we can come out of this with a social contract and move away from a social construct. That's what I'm hoping. I'm hoping that some stuff, I'm tired of always factoring in rejection. I'm tired of always factoring a plan B.
Wow.
And I would love for Lillian and Walter III and Buddy and Ava Lapusky and baby Josh, I would love for them to be able to just dream and not have a plan B in the desk drawer. And maybe, just maybe, if I add what I bring to the table to what these people are putting on the table, maybe, just maybe, Brian, we'll get a contract out of this. And when you go to build the next building and they see you Black, they'll say, praise God, let's do this deal.
Hey, Bishop.
Yeah.
I want to stay where you are right there because you're talking about the younger generations and what you would love to see as a parent, as someone who's worked with the youth at church for years, who's worked with young people for 25 years now. Um, what do you say to the men who see a generation doing things differently than they would do? Um, and because they've always factored in rejection and plan B, sometimes the men come across to the younger generations, or not just men, but older African Americans, come across as restrictive to the movements that the young people are doing now. How do we meet them? How do we combine wisdom and energy so that what's happening, they have some backing? How do we do that?
One thing every brother's got to do if you said yes to what Antoine said, and many of us did, one thing you got to do is go back to when you lost your dream. You've got to go back in your mind to when you started writing plan Bs. And remember that you were your child one day, or you were that young man one day. My wife and I have different parenting styles. So when our children were growing up, we had different styles of how we parented them. One of the things I was guided by was I was one time their age. I was one time in their situation, and I made it through, and I survived it. They will too. They'll get through it too. I just have to help them learn how to make decisions. Not make the decision, but help them understand what goes into making a decision. And so I spent the years with my children never saying what they couldn't do, but always helping them try to understand what it will take to do this. Have you answered this question? Have you answered that one? Have you answered the other one? And being their biggest supporter when they ran up against major obstacles. I really believe that it was my responsibility to help fight my children's battles that they could not fight. I remember times having to go to the school. I remember one time Joshua had practiced and done everything the school told him to do to be able to make it on the team for basketball. And he had worked hard. And he called me, I was at church. He called me one afternoon in tears because he had been cut from the team. He didn't make the team. Now he's a ninth grader. So ninth grade, you got so many layers of team, you got to make one. And he was going to McDonough. My God, he used to make one. And so I talked to him. I had to talk through the tears. I said, I'm on my way up there. I went up to school and I met with the coach. I asked Joshua to sit outside, met with the coach. And I used every skill I had because I'm a professional. I'm trained to solve problems. So I sat there and I said to the man, I said, well, listen, you all said, do this, do this. I said, he went to every summer camp that you had. He's played on the travel team for Howard County. He's done this, he's done that. And I knew how much it mattered to him. I said, he's done this, he's done that, he's done the other. Well, yes, but he just wasn't that good enough. I said, well, listen, I understand also that the sporting program of a school is intended to also help children develop in their social skills. And by the social grouping in a sporting activity, they learn new things about playing and working with other people, and especially folk across different races. Well, yes, but he did, he kept going. And by the end of that conversation, Joshua wasn't on varsity, which I didn't expect, JV, or fresh soft. He wasn't even on fresh soft now at McDonough. So I sat in the chair very polite. I said, well, Coach, let me just share this with you. I plan to be at every game that you all have this year. And I do plan to videotape every game that you have. And then at the end of the season, I will require that you and someone else explain to me how the children that are on this team are all to a person better than my son. And then I'm sure I will be convinced that you have made the right decision. Say, have a good day. Got up with Dad. Joshua said, well, what happened, Dad? I said, Joshua, we will keep on working on this. I said, but let's just go on home now. By the time I got home, he called and said Joshua was on the team. Joshua was on the team. I wasn't going to let them kill my son's dream. And if they had not accepted him on the team, we were going to find another team somewhere else. Joshua doesn't play basketball now. Has no desire to be the next Kobe Bryant. There came a moment in his development when he liked something better and realized that this would not be where he would shine. And so I never had to make that decision for him. My job was to keep showing him where he was good and to be an adult supporter, not another child having a tantrum, but to be the adult. Does that answer that?
Yeah, definitely. To be an adult supporter is critical for the young people, as you said, who aren't trying to identify one leader. You know, they since I think the first time I saw Black Lives Matter was 2014, right after Ferguson, and a lot of young leaders came out of that movement. And to your point, Bishop, you said, you know, a lot of the guys were their ages. This generation has seen Mike Brown. They've seen Tamir Rice. They've seen Trayvon Martin. They've seen young people who look like them.
Yeah.
And they've seen that some of the efforts in the past lasted for a moment, right? And so that's the next part I would like for you to kind of talk to, Bishop. How do you take what seems like it's momentary, right? We see all these companies, they got commercials and they're doing all these things, and it's great for the moment. How do we sustain momentum?
Well, one thing, and let me go to science a second. The movement is in the process of reaching critical mass. When it reaches critical mass, certain things will happen on their own. And one of the things that society specializes in is closing down stuff before it reaches critical mass. Before it becomes, before there gets to be a herd, as we talked about with the pandemic, a herd mentality. And so it's trying to close it down now. The marches, the reopening of the campaign, and all of this is intended as if to say, I'm going to bring out the negative side because I'm going to make you fight me. I'm going to make you fight me and then change the conversation. I'm going to change the narrative. But I think what our young people are doing now with this steady footfall is forcing critical mass. Then they are going after specifics and they are not waiting on somebody. What I love about it is they are not laying their demands at the palace gate and waiting for the king to get back to them. They are demanding of the king, come to here and answer to this. They are demanding, in Baltimore, for example, now not to say that I'm in favor of or against, but I marvel at the fact that they have worked to get people elected who are also supporting their initiatives. That's going to be a move. You know, November is coming. We're seeing this political shifting taking place. When it's happening little by little by little by little. And the pendulum is beginning to swing the other way. Now, what will probably happen, it will swing all the way the other way. And we may lose the wisdom of the years, but we will have different years. That's how we maintain this momentum. We've got to continue and say, I remember when some of our young people started stepping out saying, I'm running for office. Members of our church, Ryan said, I'm running. Mm-hmm. Another woman over here said, I'm running. Somebody over here, Maya Cummins said, I'm running. Because people are now saying, I'm stepping up. I'm stepping up. I'm stepping out. The other piece, Antoine, I gotta add this. Men, Our children are different from us in many ways. They're still yours. They're still mine. We have to love our children in their differentness. Their differentness does not say anything about you. It doesn't impugn you. It just says they're different. They have a different path to take. They are the ones going on a different journey. And you may see some of the pitfalls and the bricks and the rocks on their journey. This isn't the time to be a person whipping them as they go out on the journey. This is a person, you now need to be the one who is there for them on their journey. Our children will be different. We are living in an age where so much difference is being born around us. And we've got to learn that justice is not just for us. It's for everybody. It's for everybody. Any other question there, Brian, Antoine, Mo?
No, I was just going to append to what you said. I think it's so important for, and it's funny to even say this as I'm approaching 50 years old. It doesn't seem like it, but you know, for these younger people that are out in the street, it is important for them to have strategic context. So that's one thing that we can add to the discussion.
Yes.
So you know, you have this saying that you always talk about: keep on living. Well, there hasn't been as much living. It doesn't mean that they don't have a grasp of what's going on in the current times, but sometimes they don't have historical context and strategic. Yes. So where we can add significant value, I believe, is by giving strategic context, because because oftentimes when you're in the midst of something and you're young, you think you're the first person to ever have climbed this mountain. And the reality is that there are no
new mountains.
Right, there are no new mountains. So there are some strategic contexts. Now, everything that has been done in the past doesn't necessarily mean it will work into the future. But if you have a context for that, when you hear the president talking about being the law and order president, if you understand it in the context that he's taking that directly from the playbook of Nixon and those folks in the late and early in 60s and 70s, when he's talking to what he calls the silent majority, and he's basically replaying the Southern strategy. These are things that are tried and true white supremacist models that have been used, as you said, for society to knock down momentum. And if you understand it in that context, then you can address it in a different way. If you think it is just the ramblings of just a crazy man, then you're not as likely to understand how it is a dog whistle to infrastructures and societal structures that are intended to keep you from getting and ascending that mountaintop.
Yes.
So I think if we can give strategic context to the football that you say, the combination of the two actually can get us closer to where we're trying to go, as opposed to one without the other.
And see, God has called us to have that gift to bring. I learned when Freddie Gray was killed, and we tried to help in certain areas, I learned that certain people weren't going to listen to me, and because they had such a bad relationship with older people and with some preachers, that they felt they couldn't hear them. But in doing so, they missed what I could bring to the table. I wasn't trying to solve their problem or speak their truth, but I could get them the meeting they were trying to have.
Right.
I could bring them into the setting they were trying to get, if that's what they wanted. And so that's some of what we bring, and we've got to help them understand, hey, we're not trying to steal your thunder, but we can help you make it rain. Just let us help make it rain. We ain't trying to steal your thunder. But men, I gotta lay down the gauntlet on this line. We're going to see a lot that is different. And we're living in an age when difference is becoming the order of the day. I wasn't raised that way. I wasn't taught that way. Granted, you weren't. Granted, I wasn't. But God has called us to a moment when many things are in front of us. Let us try to make sure everyone has an opportunity to live his or her life with a sense of freedom, justice, and equity. Not equality, not just equality, but equity. Because some of us are so far back that it's going to take a lot to bring us up to make us equal.
Good
To
point.
make us equal.
Yes, sir.
Well, we got, just before we, listen, was this a good discussion, guys? If it
yeah.
was, in that chat, can you just type the word yes?
Absolutely.
So that we'll know that we were on a good topic today.
And
And
Bishop,
if
speaking
you
from
got
the
some
standpoint,
questions about it, if you want to continue the conversation, the men's groups are going to be continuing. I think I'm going to ask Reverend Joshua and Reverend Mo to set us up a Facebook group so that we can, as the men's group, be in a Facebook group, and we can carry on a lot of these conversations back and forth. I enjoy this kind of conversation. Full face mask may be better. Theo, real quick question. Will a full face cloth mask be better than a surgical mask?
I was just looking at that. In the context of protecting transmission from the virus, the cloth mask is probably better. The surgical mask is just to protect the surgical field, but you still can get things coming out around the side. So just in this context, the full face mask is probably better.
Like a bandana?
Yeah, but have to cover the nose. As long as it's double cut, at least double cut and double layer, it will help.
Now, brethren, I don't really recommend wearing the bandana into 7-Eleven. You might fall into the latter conversation we had. Yeah, you might be in the latter conversation.
Let me say, just from the standpoint of looking at those that are in, I guess I can say our generation. I think you're only like about 8 years older than me. But I think what I'm finding out is this is a time to be educated because many of us were not educated from, like you said, Black history, like what's available to us now. We can get that information on the internet quickly and easily. A lot of us didn't learn this in school and in our education system. For some, not even until we got into college, where we made aware of a lot of what you even talked about with, Rosewood and Black Wall Street. But I would suggest that, we try to get as educated as we possibly can.
I told y'all I'm ready for the war.
Everybody's looking like a bandit right now.
I'm ready for the war. I told y'all I'm ready for everything. I'm ready.
You know what, real quick, Bishop, somebody did ask another question real quick before we—
Where they get my equipment? Okay, go ahead.
What is your take on them changing the face of Aunt Jemima, Uncle Ben, and Mrs. Butterworth? Yeah.
Listen, people are known by what they celebrate and what they internalize. I have never picked up Aunt Jemima pancakes without thinking of the stereotype of slavery. I have never ridden past Confederate monuments without feeling that America celebrated them and wished they had won. Only as it relates to race do we celebrate the losers and make those who were liberated from their oppression remember them and know that they are hallowed and respected in the land. I feel in no ways a bitter remorse for bidding farewell to the stereotype. Now, Aunt Jemima probably made good pancakes. Uncle Ben had great rice. But I have no regrets for the abandonment of the stereotype of what they represent to a nation and who they are in the minds of people. Now, tear it all down. Tear it all down, because we need to rid ourselves of the influences that still give a people the sense that that there is something to celebrate in our demise. Yeah.
Amen.
Yep.
Amen. Thanks, Bishop.
Well, guys, I think our time is well spent. I have to decide which form of protection I'm going to use as I go forward today, whether I will be in bandana, whether I shall be in my hat shield, whether I shall be in my mask or my overshield. But I promise you, if you see me out in the street, I'll be covered up.
Amen.
Dr. Theo, thank you so much for today.
You're welcome. You're welcome.
And
Appreciate
guys, I hope everybody's had a good time today. I hope we laughed and joked and had a good time. And my guys who've led with me, thank you so much. Now, don't forget tomorrow, it's Men's Day. Ain't nobody taking us to dinner. So don't be looking for it. I know Baltimore City's open, but ain't nobody taking you nowhere.
Nope,
They're going to
stay
claim the virus.
I know.
And there ain't going to be no barbecue out in the backyard. There might be, listen, my wife and I barbecued on Memorial Day, and we realized, Spirit told me don't light the grill, because last time I lit it, it blew me upside the wall. But so Spirit said, don't light the grill. Oh, Father's Day. No, this, don't get an assistant. These assistants keep bopping in. They just come in and correct you at any minute. Memorial Day. All right, Father's Day. One of them days. It was whatever day.
Hey,
So,
Bishop,
yes,
real
sir.
quick. So, guys, it might be hard to see my phone, but I got the notification that we do have the AMG private group already set up on Facebook. So if you are friends with Minister Mo or Brian or myself, send us a message on Facebook or text or however you have it, so we can invite you and add you to that group. New Psalmist moves fast, y'all. We said it and it already exists. So we're ready to start inviting brothers to the private group on Facebook for men.
And it'll be a private group, won't be open to the world. So you all have to sign up. They have to admit you into the group. Okay. But listen, when we barbecued, Antoine, it was my wife and I, and we realized wasn't nobody else eating. And my wife don't eat hamburgers, so we had one hamburger and 2 hot dogs.
And you lit the grill for that.
No, let me tell you, I use my new wave oven grill. Y'all, let's close out and go home. Because the wives are waiting for y'all, and the girlfriends are waiting for y'all, and the people who are trying to call you are waiting for you. Father, we thank you for our time and our sharing, and thank you for this good morning activity. In Jesus' name. Now, bless tomorrow, God. In Jesus' name, amen. Now, guys, leave your offering so we got collected and turn it in for the men.
That's
Take
right.
care, everybody.
All right.
God
Bye-bye.
bless. Thanks, Bishop. See y'all later.
All right.